Hi guys, I'm Rose,
And I'm Carly.
and today we're going to be talking about rising patient safety issues that are related to nurse-patient ratios. So we'll start with the critical points. So about 90% of nurses actually report that they do not have the time to provide adequate comfort and emotional support to their patients as well as family members. And 86% of those nurses say they cannot spend as much time on patient education as would be ideal. When nurses are forced to work with high nurse to patient ratios, patients can acquire infections. Those infections can include things like central line infections and healthcare associated infections. They can also have falls or become injured, like pressure ulcers, and they may possibly die. Others are discharged too soon without adequate education about how to take care of their illness or injury, and most likely they'll return back too soon. So if they return back to the hospital, they may often be sicker than they were previously during their first admission. And this also contributes to higher patient care costs due to unplanned readmissions, and the hospital runs the risk of not being reimbursed by the insurance companies due to the readmission happening too soon after discharge. When nurses have fewer patients, they are more likely to intervene and prevent errors, so fewer patients get injured or die. And when the nurses have more time to advocate with physicians, insurance companies, or others about the patient's care plan to make sure the patient gets everything they need, patients are more likely to thrive. According to a 2007 study on safe staffing in medical care, an increase of one registered nurse per patient was associated with a 24% reduction in time spent in the intensive care unit and a 31% reduction in time spent in surgical units. In long-term care facilities, patients with more direct nurse time, so about 30 to 40 minutes daily per patient, reported fewer pressure ulcers, acute care hospitalizations, urinary catheters, and urinary tract infections, and less deterioration in their ability to perform their ADLs, their activities of daily living. A 2017 study published in the Annals of Intensive Care found that a higher nurse staffing ratio was tied to increased survival likelihood. The analysis included 845 patients and found that they were 95% more likely to survive when nurses followed a hospital-mandated patient-nurse ratio. This isn't just a problem in the United States either. It's actually a global issue. In England's hospital, a nurse is supposed to look after no more than 8 medical patients. The ratio is adjusted by unit and can be as low as 1-to-1 in a neonatal and intensive care units. Analysis of official data by the Health Services Journal showed almost every hospital in England had insufficient nurses on duty to guarantee safe patient care. 96% of those hospitals had fewer nurses covering the day shifts in October of 2016 than they had planned for, and 85% were short-staffed at night. So when we're talking about the UK's National Health Service, only 20% of their trust chief executives were confident that they had the right staff numbers, quality, and skill mix to deliver high-quality healthcare for patients. Unfortunately, only 22% of those executives were confident about having the right staffing levels in 6 months' time. So now we'll talk about some of the relevant policies. So California is the only state in the United States that's passed a mandated ratio in all hospital departments. Their law requires a minimum nurse-to-patient ratio to be maintained at all times by unit. So in 2018, Massachusetts passed a law specific to their ICU requiring a 1-to-1 or 1-to-2 nurse-to-patient ratio, depending on the stability of the patient. But they also had put up for legislation one that would mimic California's for all of their units, and unfortunately the voters rejected that bill that would have mandated those safe nurse-to-patient ratios. In total, 14 states have introduced different types of legislation that mandate nurse-staff ratios and patient maximums, and others have established ratios in individual departments. A survey in 2010 showed that California's nurse staffing ratios accompanied a lower likelihood of inpatient death within 30 days of hospital admission than similar states like New Jersey or Pennsylvania. In California, there was also a lower likelihood of death from failing to properly respond to symptoms. California reported a 13.9% fewer surgical deaths than New Jersey and 10% fewer surgical deaths than Pennsylvania. Now I'll hand it over to Carly.
Thank you, Rose.
You're welcome.
So now let's talk about some benefits and drawbacks of increased staffing. So the relationship between nurses and the number of patients is pretty well established in literature. Majority of literature about nurse staffing and patient outcomes suggests a greater number of nurses, resulting in an overall better patient outcome. Studies have found increased proportions of nurses to be associated with lower patient mortality rates, lower rates of adverse hospital events, including pressure ulcers, urinary tract infections, falls, and other adverse patient outcomes, which, Rose, you did touch on. Other studies have found a significant effect on nursing turnover, burnout, job dissatisfaction, and intent to leave. So it's not just patients that are affected by staffing levels. The drawbacks, on the other hand, include cost and long waiting times for patients. Fewer patients per nurse require the number of employed nurses to increase. This can cost hospitals millions of dollars. It may even require systems to cut back in other departments. Consequently, overall healthcare costs are going to continue to rise. Also, regulated ratios can result in patients not receiving immediate treatment. So let's say, for example, there's a disaster and there's a large influx of patients coming to the ER. If there is a mandated ratio, nurses may not be able to maintain that, and patients might not get the immediate treatment they need. So the impact on healthcare and nursing is pretty evident. We did touch on that already, but some things that cause this stress is cost-cutting decisions, an aging population, increased patient complexity and needs, and an aging workforce. The healthcare system as a whole has faced consequences of this. So, as discussed previously, evidence has shown the need for adequate staffing for both patient and nurses' sake. According to the ANA, collaborative efforts have resulted in balanced state-level staffing legislation. As stated previously, as of July of this year, there are 14 states that have a nurse staffing law or regulation. So let's review those. Seven states require nurse-led staffing committees. These include Connecticut, Illinois, Nevada, Ohio, Oregon, Texas, and Washington. California is the only state that has a law-mandated ratio. Massachusetts has a law for ICUs only, and Rose touched on that as well. So it's the 1-to-1 or the 1-to-2 ratio, depending on the stability of the patient. Minnesota requires a CNO or a designee to develop a core staffing plan. And lastly, Illinois, New Jersey, and New York, also Rhode Island and Vermont, all require some form of disclosure or public reporting. Staffing issues are becoming more acknowledged and addressed because nurses are speaking up and taking action. With evidence showing improved patient outcomes and increased nursing satisfaction, the healthcare system is likely to continue to see change. Regardless of if it's mandated ratios or nurse-driven staffing committees, both the healthcare system and the nursing profession will continue to be shaped by this important issue. We will be entering into the largest group of healthcare professionals. Simply becoming RNs and entering the workforce will be a contribution to the solution. We are taking actions to further improve this issue by speaking up, lobbying, or participating in our hospital staffing committees. There are so many steps that can be taken. What will you take?